All right, you're welcome back. This is the pulse here on Joy News. And of course, we started with the matter relating to the Ghana Registered Nurses and Midwives Association. They undertook a strike on Tuesday, and it's in the second day. The health minister is not sitting down. He's already in the hospitals, ensuring that people who go to the hospital are given the health attention that they need. And so let's find out how his familiarization tour went today. Honorable Kobra Minta Kando is the health minister, and he joins me. Honorable, good afternoon. Welcome to the program.
Good afternoon, my brother. How are you?
I'm doing well, and I just saw you in a video that we played. I mean, visiting some of these hospitals and interacting with those who decided to stay back and work. How would you describe the situation as we have it today?
Well, in summary, what I would say to the situation I saw at the facilities is that even if one nurse decides not to go to the hospital, it has implications on the healthcare delivery, even one. And so we will appeal to all of them to get back to the hospital as we sit around the table and resolve the issues. Elton, the issue under contention here has to do with the implementation of collective agreements signed by the former regime.
Right.
Which was supposed to be implemented last year. For whatever reason, it was not implemented. Let me be quick to add that governance is continuing. And so I concede that anything, any demand by any health worker, which is reasonable and legitimate, must be pursued by the ministry. And so since I took office for the past 3 to 4 months, I've been engaging them. And in some cases, we try to get resolution to some of the issues. I was a bit taken aback when there was no communication whatsoever, and it just came as a shock that we've declared a roadmap that we are embarking on a strike. I believe that in all these matters, my brothers and sisters should put the Ghanaian patient into consideration. We are not tired. We are operating an open door policy, and I am ready to engage and meet anybody at any given time. Not until we find a lasting solution to the matter, we will not relax. Just yesterday, all the other stakeholders were brought on board. We were around the table. The Ministry of Health was around the table. Ministry of Finance was around the table. Fair Wages was there. Labor Commission. But my brothers and sisters couldn't come. You understand? And there was a ruling to that effect. But that is not even my interest. We are the mother ministry, and we must behave as mothers. And so we are calling on them to come and let's talk. Look, we have been in constant interaction with the Ministry of Finance, and you know this goes beyond the Ministry of Health.
But our understanding is that the matter is now on the decks of the finance. It may not be your problem, but because they are under you in terms of employment. But what our checks suggest that it is up to now to the Minister of Finance to sign off on it so that this can have some kind of implementation.
But not until I cannot absolve myself completely from it, unless you are absolving me. But I cannot absolve myself or my ministry completely out of it until the full implementation of the agreement. We cannot take ourselves from it because we are their employees. Okay? And so, yes, I agree that where it has gotten to, the minister or the Ministry of Finance will have to play a key role of which we are engaging the ministry. But I can tell you the Minister of Finance is committed in finding solutions to this matter. He is so committed. I'll be speaking to him, but we cannot be on a strike and negotiate at the same time.
Right.
With the greatest of respect, I think they must come. Even today, this night, they want to meet me. And I've been trying to reach out to them. So Ethan, all that I'm saying is that look, we do not want to underrate the impact of the industrial action, not at all. I am not ready to underrate it. Even if one person absents himself or herself from going to work, it has its own implication. So not until this matter is resolved, I am not prepared to relax. And I'm not ready to push responsibility onto anybody. I'm not ready to, say, oh, because it's not a matter of the Ministry of Health, no. That is not what I'm interested in now. I am ready to be on board fully to make sure that we have an amicable solution to this matter and they return to the various hospitals and then do what they are supposed to do for the betterment of the country so that we don't lose any life that is, preventable situation. And so, listen, anybody listening to me now, they know the efforts I put in to resolve other complicated issues. They know. So, since I came, I've opened my doors. We've met about more than 6 times.
Okay.
You see, when you don't have anybody to listen to you, when nobody is opening his or her door to you, you have nobody to hear you out, and you are frustrated, and you are embarking on such an action. You have every right to do so. When, it is not when we are ready. Anytime, both official and non-official, to listen to you to find solutions, with the greatest of respect. Life lost can never be retrieved. And that is what I think we must all consider. Yeah.
So Honorable, what will it take to get this agreed, conditions of service underway?
So you see, our last meeting, in fact, our last Batwa meeting before they declared the roadmap, we agreed that all the stakeholders must come together and see how we can all implement this thing. Yesterday, a similar thing happened. So I'm even informed that the fair wages on Monday is also willing. We want to be very objective. An independent body should come in here. The independent body will be able to look into the face of the Ministry of Health or Ministry of Finance and say, hey, you are supposed to do this. And so let's go this route. You see, we are not ready to intimidate anybody. And I pray and hope that nobody is also prepared to intimidate government. Let's sit around the table, find a solution to the matter, and we have frank discussions. And then we know that, look, this is what we are in for. And then, so I have assessed the situation. I've gone to the grounds. I've toured the places. But, yesterday we were in Rwanda to pursue the Director General for the African Medicine Agency.
Yes.
Director General, you remember?
Yes.
Yes. So, immediately I touched down, I had to quickly go to the field and then assess the ground. So, we'll continue. But I'm just calling everybody, cool heads. Let's massage our egos. Let's put our emotions aside. We have Ghanaians to protect. We have Ghanaians to save their lives. We have economy to run. Let's put all the issues together and find a solution to them.
My final question, because you are busy. This morning, for example, a pregnant woman, also bitten by snake, went to the Wa Regional Hospital, but there was nobody to attend to her. At Pampapso, the Children's Hospital in Kumasi, a 6-month-old pregnant woman suffered burns, also went there, and then she was told that nurses...
These are all the things we want to avoid.
So in the interim...
These are all the things we want to avoid. And of course, I think that everywhere I attended or I have visited this evening, the medical doctors are also at post. They are working... And I think we must avoid these things. It's not worth it. It's not worth it. I get emotional when I hear some of these things.
All right, Honorable, we are with you on this, and hopefully some resolution can be brought on this matter so that the nurses and midwives can get back to work.
I pray so. Okay, thank you very much.
Let me bring in the Assistant Public Relations Officer of the National Labour Commission. They've described this as illegal. Julia Ponguzi. Julia, good afternoon. Welcome to the poll. So you say this is illegal. Beyond writing it, what are you doing to get them to go back to the ward and work? Hi, Madam Julia, if you can hear me. Well, we'll try and get her attention and bring her on. She's the Assistant Public Relations Officer of the National Labour Commission. In a statement, they've described this strike by the Nurses and Midwives Association as illegal. And so we want to understand what they intend doing beyond writing this and asking them to return to work. But this is the pause here on Joy. You heard the minister says that they are still engaging. Even tonight, they're having another meeting to see how best they can resolve the matters relating to the nurses and midwives. They say that this set of conditions agreed and signed by the employer and the employee, awaiting Ministry of Finance clearance so that implementation can start, was done last year. Government or governance is a continuous program. Even though the NDC is new in office, they expect that implementation should start as early as possible. And this is already creating issues across the country as people who are in search of urgent healthcare are denied. And they made it clear that they may even get those who are on admission out of the hospital so that the strike can take full effect. Let me see if I can bring in Julia again. Julia, good afternoon. Welcome to the Pulse. Great to have you. So, in a statement that we just read, the National Labour Commission says what is happening is illegal, and they are asking the striking nurses and midwives to go back to work. And I'm asking, beyond saying that it's illegal, what more is the Labour Commission doing to compel them to, report to work?
Yes, so far what we have done is to order them to go back, to call off their strike with immediate effect, as well as to resume work at their respective facilities. And the fair wages is supposed to lead the engagements between the union and the employer. As you are aware, fair wages is the lead negotiator for government. And the reason why we are also asking them to call off the strike is to enable parties engaged to reach an amicable settlement. It is unfortunate if they are unwilling to call off the strike, but it's prudent that they call off the strike so that parties can reach a settlement. We all understand that they are an essential service, and as a result of that, their strike is supposed to be settled within 3 days. So if they're on strike, it doesn't create that cooling off period for parties to come together to engage or to negotiate, which is unfair. It's an unfair labor practice if you look at things from that aspect. So we are calling on them to call off the strike, taking into consideration the fact that they are an essential service, and it's prudent that they call off the strike for parties to be able to engage on that note.
What about the concerns that they have that even though they have agreed with governments on new conditions of service, government is reluctant to implement it? Surely they have a case.
Okay, so at the hearing, their employer has acknowledged the importance of engaging with them to resolve all these issues of non-implementation of their conditions of service. And that is how come it was unfortunate that they were unable to appear before the hearing yesterday, because it would have helped the commission find ways and means of addressing the issue. But because they were unable to appear, the commission had a one-party hearing that is only listening to the employer, and as a result, concluded that it was prudent, looking at the fact that they are an essential service. The commission directed that their employer meets them with as soon as possible, because, they're going on strike means there is likelihood of loss of life. And that is not what the commission seeks to achieve. So, the commission has ordered the employer to quickly meet them and resolve this as soon as possible. And also the commission has indicated that they should meet as soon as possible, as well as provide us with a status report of the outcome on 25th June 2025, 2:30 p.m. So the next time we would be meeting both parties will be on the 25th June at 2:30 p.m. for parties to give us a status report on the level of engagement and if they have a roadmap to the implementation of the agreed CA, or if they have a timeline for it, then they come and notify the commission on the 25th of June.
So until the 25th of June, you expect that they go back to work?
Yes, please.
All right. Waovi Juliet is the Assistant Public Relations Officer with the National Labour Corps. Thank you so much for your time this afternoon. Now let's talk about some money matters. And the Bank of Ghana has posted a staggering loss of 9.4 billion Ghana cedis, making the third consecutive year in deficit and heightening concerns over the central bank's financial stability and economic stewardship. Notably, despite injecting 4.7 billion into the Gold for Oil program, the bank still recorded a 1.8 billion cedi loss in 2024 alone, raising serious questions about the program's effectiveness and overall financial viability. And of course, on Business Live, that is coming up at 5 p.m., Pius, my colleague, will deal with more, will bring you more on this Bank of Ghana financial statement for 2024. That is coming up in the next 30 minutes here on Joy News. This is the pause. Of course, let's deal with some other stories now. And the Ningo Pram Municipal Health Director, Patience Ami Mamata, has expressed worry over the negative impact of lead poisoning in pregnant women, fetus, and anyone who comes into contact with lead. Findings of a research carried out paints a gloomy picture as adults, especially children, have high levels of lead in their blood. Patience Ami Mamata was speaking at the launch of the Coalition Against Lead Poisoning pollution projects here in Accra.
The exposure to lead poisoning and its long-term impact on health has become an issue of worry for Ghana and other stakeholders. Generally, lead in blood results in damaging of vital organs, leading to death in some cases. A research carried out by Pure Earth and partners revealed a disturbing situation. Out of 405 children, close to 60% had lead in their blood. Ningo Pram Municipal Health Director, Patience Ami Mamata, says exposure to used car batteries, smelting, burning, amongst others, are sources of lead poisoning. She said this at the launch of the Coalition Against Lead Pollution project for Ningo Pram and Kwon Katamanso municipalities.
I'm just bringing to home how dangerous or threatening to health lead is. So, by a week's time, when the team had arrived from the US and Ghana, UNICEF, and we went to this key stakeholder, we couldn't find him. In fact, he was dead. He was dead. And once we tried to do verbal autopsy, the relatives told us that he had kidney failure. In fact, there was a series of time we go to the workshop and he was working without protective gears.
The Kwon Katamanso Municipal Health Director, Dr. Esther Priscilla Biama Dankwansa, encouraged stakeholders to take plans to treat children with high blood levels of lead, just as is being done on the education. Country Director for Pure Earth, Esmond Wisdom Kwansa, called for close collaboration among stakeholders to help mitigate the impact of lead poisoning.
This initiative, as you see, is community-driven. We are working with the locals, the community, the district assembly, and also the chiefs to be able to educate, train, and address the issue of lead pollution as far as this is concerned. Yes, the students are involved. We'll be training about 1,200 children in this community over the next 1 year.
Meanwhile, Acting Director, Ghana National Cleanup Production Center of the Environmental Protection Agency, Letitia Abrakumnyaba, said the agency is much concerned about lead poisoning. She believes proper recycling and handling methods will minimize risks.
The recycling should be done sustainably. Let's uphold to all the conditions that are applicable to recycling lead sustainably. So we shouldn't break the batteries, we should hand them in whole, we should store them properly, and during the smelting process, all the conditions for sustainable and environmentally friendly recycling should be adhered to.
In attendance were pupils, Ningo Pram Municipal Assembly, Kwon Katamanso Municipal Assembly, and members of both Ningo Pram and Kwon.
Well, the Chamber of Local Governance is expressing concern that government is not being transparent regarding a directive for district assemblies common fund to release 80% of allocations to assemblies. Finance Minister Dr. Kesa Latofosen yesterday announced the release of over 987 million Ghana cedis to the District Assemblies Common Fund for onward allocation to the various assemblies as part of the over 7 billion cedi allocation to the District Assemblies Fund.
Decisions taken in recent years have regrettably undermined the capacity of MMDAs to respond effectively to the pressing needs of our people at the local level. Right Honourable Speaker, in the past 8 years, a paltry 40% to 50% of transfers to the Common Fund were disbursed directly to the district assemblies, thereby denying MMDAs the ability to spur local economic development. Mr. Speaker, the government under President John Mahama is resolute in its determination to reverse this trend. We are committed to adequately resource MMDAs and ensure that effective and accountable utilization of these resources are maintained at all times. In line with our promise to revitalize the local economy, President Mahama's administration has prioritized improving financial strength of the district assemblies. I wish to commend members of this House for endorsing, as part of the 2025 budget, government proposal to ensure that a minimum of 80% of allocated District Assembly Common Fund resources are transferred directly to MMDAs. Mr. Speaker, in view of that, every District Assembly will receive a minimum of 25 million Ghana cedis this year. A minimum of 25 million Ghana cedis this year. Mr. Speaker, our resource extends beyond mere release of funds. We have taken decisive steps to ensure that these resources are utilized in line with government economic objectives. Mr. Speaker, as I say, a minimum of 25 million Ghana cedis will go to every district assembly, a minimum. As at yesterday, we have transferred the sum of 987 million. Mr. Speaker, as at yesterday, the district assemblies has received, and we have the District Assembly Common Fund has received, and we have transferred the sum of 965,965,073 Ghana cedis from the Consolidated Fund to the District Assemblies Common Fund, being the first quarter amount due the District Assembly Common Fund for the year 2025.
All right, before we go, let me take you outside the shores of Ghana. And U.S. President Donald Trump and the new German Chancellor Friedrich Merz are meeting in Washington, D.C. this week. It is the first time the two leaders are meeting face to face, and the first official trip to the U.S. as Chancellor Merz. Here with more on this particular story is Emily Lechner in Berlin, and I'm interested in knowing the kind of topics that the two leaders will be discussing.
There are three central topics of discussion. The first is the war in Ukraine, of course. Trump told Merz during a phone conversation a few weeks ago that he supports European efforts to bring an end to the conflict. So there will certainly be talk of how to do this, or at the very least, how to get Russia to agree to an unconditional ceasefire. Then there is the issue of trade. The 50% tariffs on steel and aluminum just went into effect. And if Europe and the White House can't agree on a deal by July 9th, then Europe will see 50% tariffs on all other imports coming into the U.S. Germany is facing a recession. Its manufacturing sector, particularly the auto sector, isn't doing well. So Merz has a big incentive to find a solution by this new deadline. And the other item of discussion at the meeting is going to be how to calm growing tensions in the Middle East.
Well, Merz hasn't been in office very long. Does he have enough of a relationship with Trump to sway the needle on any of these issues when other EU leaders haven't been able to do so?
Yeah, that's right. I mean, the fact that Merz doesn't have much of a history with Trump yet may work to his advantage right now. At the moment, Trump and Merz at least appear to have gotten off on the right foot. Merz is staying at the official guest house of the White House. That's considered an honor. German media is even reporting that Trump and Merz are on a first name basis. So maybe I should say Donald and Friedrich. And that they've even swapped cell phone numbers. There will be a luncheon. There will be a press conference as well. So there's the optics right now are that they are getting along. And Merz has made foreign policy a major focus so far, and he seems to be positioning himself as an important broker between the White House and Europe, similar to what we have seen with French President Emmanuel Macron and Trump. But Merz and Trump don't always see eye to eye. Trump wants NATO members, for example, like Germany, to increase their financial contributions to 5% of their GDP to the organization. This is something that Merz insisted during his election campaign that Germany wouldn't do, even though now he seems to have come around to the idea through a proposal that's being drafted by NATO's head, Mark Rutte. So Trump might take this as a sign that Merz is willing to negotiate and come around to his side. That may help Merz in the future. But we also may see some friction when the finer points of this proposal are being discussed. And when it comes to ending the trade war as well. So not everything is harmonious, even though right now it does seem that they are getting along.
And then finally, are there more points of friction between Berlin and Washington?
There has been some tension, particularly between Berlin and some of the members of Trump's administration. For example, Trump's Vice President, J.D. Vance, as well as his Secretary of State, Marco Rubio. They criticized Germany for labeling one of its political parties, the AfD, or Alternative for Deutschland, as a right-wing extremist organization. And to that criticism, Merz responded by essentially saying that the White House shouldn't preoccupy itself with domestic German politics. Merz also scolded Vance for what he called overreach when Vance said that Europe was threatening democracy, though there certainly has been some tension between Berlin and Washington so far.
Emily, let's now with our partners, DWTV from Washington, D.C. Well, folks, that's our show for today. For more stories, log on to our website, myjoyonline.com. GPLT threatens nationwide strike over new 1 cedi fuel levy. 24 arrested for illegal mining at Bui Subinso, including 14 Chinese nationals. Bank of Ghana posts operating loss of 9.4 billion Ghana cedis. Takeaway packs to be banned soon. That's according to President Mahama. These plus other interesting stories on myjoyonline.com. Folks, whatever you are up to in the hours ahead, I hope it's profitable. Same time tomorrow, we shall be here to bring you the holiday edition of The Pulse. My name is Elton Brobe. Have a good evening and take care.